And I'd like to welcome you on behalf of Health Votes Montana. It is a coalition of the American Heart Association, the American Lung Association, the American Cancer Society, Cancer Action Network, the Multiple Sclerosis Association, and then the Montana Public Health Association, and also the Alliance for Montana Public Health Officials. And this group has been together since, gosh, probably 1998 to work on issues of concern to those of us who consume healthcare, those of us with chronic disease, those of us that are commonly referred to as the 20% that cost 80% of the healthcare costs. And there's a lot of concerns that our constituencies have with regard to access to care and how we prevent. Just for example, I do work for the American Cancer Society, Cancer Action Network. Again, my name is Kristen Nye. And 50% of cancer-related deaths could be prevented if people had access to prevention, whether it be good conversations with their physicians about quitting smoking, to access to cancer screening when it best serves their needs. And we, throughout the course of time, have realized that if we're truly going to reduce cancer incidence rates and mortality rates, that we really have to look at systems changes. And that's why we're involved in the legislative process. We learned long ago that the folks that are sitting here today, who many of will be elected officials, will make decisions that impact the lives of each of us and how we consume healthcare. They will get to determine who qualifies for public insurance, right? They get to determine what prevention programs are housed in Health and Human Services, whether they're effective or not. And they will get to determine what rules and regulations and oversight government has on private health insurance as well. And so we felt that it was important to have a discussion about healthcare based on the patient's perspective. And so that's why we're having this forum. We welcome you to the first ever Health Votes Montana. This is a series of candidate forums that this is the first year for them. We had one in Bozeman Tuesday evening. This one tonight. There will be one in Helena on Thursday, and next Tuesday in Billings. And I have to say, the Bozeman one was great, so you guys have a lot of work to do. So how tonight is going to work is, I want to remind folks that our organizations are nonprofits, and we are nonpartisan, and we do not endorse candidates. We feel that our constituents win when both parties listen, when all candidates listen to what their constituents have to say on this issue. So how we're going to run this tonight is I will be asking questions. They received about 12 questions that our groups had come together and determined, many of which were asked of the two gubernatorial candidates in Helena, I think it was Tuesday. And then each one will have a chance to answer. Now there's a few candidates that have to leave early, and so we will do our best to make sure that you get to answer, but we will be going in order. We'll start with one Senate district for the first question, and then for the second question, we'll go on to another Senate district. I have folks housed at their at their tables by Senate districts. So Senate District 46 and the two House districts that are housed within Senate District 46, and so on. So, but before we get started, I'm going to have each candidate just introduce themselves and just an overarching message about what the importance of healthcare to them and how they expect to work with the incoming governor, because we'll have a new administration, and also the constituents that we represent. So let's see, let's start with Senator Larson, who is also a candidate for Senate District 50. So Cliff, we'll have you start by introducing yourself, maybe briefly sharing with us where your district is, and then just over, a simple statement, if you can, on healthcare and how you plan to work with the administration.
Do you want to use that mic here?
Thank you.
Good evening. I'm Senator Cliff Larson, Senate District 50. You're sitting in my district. It runs from the bridge all the way in a giant horseshoe all the way out to Alberton, around up to the Idaho line, down Lolo Creek, including Lolo, Big Flat. I think I counted at one time 4 years ago, and I think there's 49 creek drainages in Senate District 50. The highest point in the county, which is Lolo Peak, and the lowest point in the county, which is the Clark Fork River at Alberton. There are about 22,000 people live in that district. It's urban, it's suburban, it's rural. And it's a fascinating district. I am enjoying representing the people of the Senate district. A little about myself. I have been in business for about 40 years. Most of that time in business has been related to mental health, drug and alcohol abuse, and general medical services, including creating some businesses that provided health services for insurance companies and large self-insured organizations. With respect to the legislature, one of my most endearing projects is and was the Insure Montana product, which grew out of the tobacco tax settlement money, along with Senior RX program, and a couple of others. I was privileged to be the first chairman of the board of that organization and created the 3 choices of health plans for small employers who elected and were chosen to participate in that program. And the money that came from the tobacco tax settlement helped subsidize insurance premiums for the employer, for their employees, and basically the general public got to benefit because we had improved general health for about 45,000 Montanans that had previously never been insured. So those individuals who participated as employees had to pay some of the premium, the employer paid some of the premium, and the remainder was paid from the tobacco tax settlement. So those kinds of programs that generate and really help support good public health are near and dear to me with my nearly 40 years of experience in mental health and general health. Thank you very much.
And in my haste, I forgot to let people know, thank you, Senator Larson, that we're going to be giving you 90 seconds to respond to each of the questions, including the introduction. Thank you. And that microphone is live. So you're next. Before I interrupt you one more time, because this is going to be recorded and being used through Community Access TV, and then also through Town Square Media, if you could state your name before you answer, that would be great as well. Thank you.
Yes, I'm Dave Andrews. I'm a Democrat running in House District 100, which is half of Cliff's district. It's sort of the southwest half, Lolo and regions in Missoula County outside the city. I've had a career in science, business, and education. I got a PhD in physics from Cornell, did research there for a while, and then I went to work for a high-tech manufacturing company. And this medical audience may be interested to know that the product we were working on was magnetic resonance imaging technology. It was an exciting time. This was the early 80s. This was a brand new technology, and it was a lot of fun. I stayed with that company for 22 years. The last 8 years I was vice president of one of the divisions responsible for getting new business. I'm new to politics. Except for a couple terms on a school board, I also served as a school board president. I think there's clear work that the legislature has to do in the coming session, and it's associated with the Affordable Care Act. I was a little surprised in the questions that the Affordable Care Act is listed as sort of one of several options for addressing things. The Affordable Care Act is the law of the land, and it's, despite the rhetoric in this political season, it's highly unlikely that it won't be here next year. So the focus of the legislature has to be on getting implementation of the Affordable Care Act.
Thank you.
My name's Kimberly Dudick, and I'm running for to represent House District 99, which is the other half of Cliff Larson's Senate District. It's the north side, the west side, Grant Creek, Butler Creek, heading up towards Evero. It's a pretty diverse area. I'm from Missoula and I've lived here most of my life. I've chosen to live here now with my husband and 2 small children. They're about 2 and 4. And I've chosen to live in the same communities I grew up in because it's such a great place. My background is as an attorney, as a registered nurse. I have a master's in public health. I've also worked as a domestic violence advocate and small business owner. My nursing career specialized in neonatal intensive care, taking care of premature and small infants. And as an attorney, I specialize in protecting children in abusive home situations, both as a deputy Gallatin County attorney and also as an assistant attorney general, which I've done for the last 3 years until June. And I'm running for the legislature because I hope to make our government more effective and more accountable and more accessible to the citizens of Montana. I think I'm uniquely suited with my qualifications to make our government actually work to improve the health of our citizens. I'm very concerned about our public's health, and I plan to work with all parties and all elected officials to make our healthcare more accessible, more affordable, and really to promote a quality of healthcare in Montana that serves all citizens. And I look forward to serving in the legislature and working towards that. Thank you.
Hi, I'm Nancy Wilson. I'm running for House District 97. It's a nice little pie slice, starting at the river, heading to the north side of 6th, and then it just slides on out up to including South Avenue as it gets past Reserve, so and the Target Range area. I've lived in Missoula for almost 30 years. I grew up a block from the Capitol in Helena, and my father worked for public health. In fact, he was the state registrar, and probably if you were born in Montana, signed your birth certificate. So I know about public health and I know about its importance. I'm a single mom. I have 2 daughters. I also know the challenges of struggling with income. I am a neighborhood activist, is how I got involved in politics. And the biggest thing I know recently about healthcare is how do we get people to healthcare, particularly elderly people and rural areas, trying just to get to healthcare. So there's a lot of issues with that, but mostly I would be looking to you all, to the folks that really understand and know the issues, to inform me, because I'm new and I have a lot to learn. So I would be looking to you all to tell me what's the right thing to look towards. So thank you.
Good evening. My name is Carolyn Squires, and I represent House District 96. I'm pretty long in the tooth, that many of you may know. I've been in the legislature quite a period of time. And I'm pleased to be here. My area represents Missoula Community Hospital, Southgate Mall, go further out and get to the river, cross it and go across 93 and get a part of Lower Miller Creek. I've represented almost all of that area. It's Nancy's, Cliffs, whatever, in the process of my longevity. My past life, when I was working, I was a licensed practical nurse at Missoula Community Hospital. And I spent my time there as what we called a float nurse, but I primarily worked on the medical floor. And in the medical floor, you get to really love people, and you get to really want to be a part of, and you are a part of their family. And one of the diseases that I dealt with primarily is one of the ones that we're going to talk about today, and that's cancer, and what devastation it has upon families and decisions that must be made and not be made for an individual. So I'm anxious to be here. Cardiac was a problem equally as well, but there was never anything quite as devastating as the cancer patient. One of the areas of concern that I have is access, whether it be through a doctor, whether it be through a PAC, whether it be through a nurse practitioner, an osteopath. I want to explore the avenues with which to and be able to administer healthcare. And I also want to just say I support the American Care Act wholeheartedly. Thank you. I don't think so. Maybe so.
Fred, there is a microphone right in front of Representative or Senator Barrett. If you could turn.
He prefers this one.
Okay.
Can I use this one?
If you want to move around, you bet.
I apologize.
Not a problem.
Thank you. My name is Fred Carl. I'm running in Senate District 47, which is the university area, South Hills, and Patty Canyon. I have lived in Missoula or around here for over 50 years. My wife and I moved here from Buffalo, New York. At that time, we had a 6-year-old, a 5-year-old, a 3-year-old. Got to Missoula with no job, and we had all of $157. I worked by find a job, and I found a job. I decided to go back to school. My dad died, I was 14. My father died of cancer. And my high school coach got to kick me in the butt when I needed it. And I wanted to help some kids the way he helped me. So I went into back to school, got a degree in education, taught and coached for a while, and several of the students went into teaching, coaching because of me, and I'm very proud of that. The reason I am running, we are in a terrible mess. I have grandkids. Do you have grandkids? I am doing this for the kids. I don't know how they're going to survive, but they will, but I'll do whatever I can to help. Montana has a lot to offer, and I hope that we can give the things and arrange the things and bring the businesses to give the taxes to help the things that we have to do for the children. Thank you. Thank you.
There you go.
Okay. I'm Dick Barrett. I represent House District 93 right now, but I'm running against Fred for Senate District 47, which, as he has described, is basically the southeast quadrant of Missoula. Unlike many of the distinguished people here, I don't really have a professional background in healthcare. I taught economics at the university for 37 years. I have, and my work in the legislature has mostly been in the area of taxes. I've been on the tax committee for 2 sessions. But that said, I think we all know that addressing issues of healthcare are going to be a primary concern of the coming legislature. I wish there was more certainty about it. I think that we are at present in a very fluid atmosphere, politically speaking. I was intrigued by the idea that we should talk about how we're going to work with the new governor when we don't know who the new governor is going to be. There's a lot up in the air. And so I don't think we're going to be able to give you necessarily the certainty that you might like until after the elections. Thank you.
Thank you. My name is Paul Marcusa. I'm running to represent House District 92, which is the Rattlesnake area and the northeastern portion of the county, which runs up to City Lake, Condon, and that whole region of the county. I'm 30 years old. I'm currently a homeowner here in the county, which I'm very proud of. You know, I did that all by myself. I'm a truck driver. I'm a vegetarian, largely because, you know, my mother was very obsessed with nutrition when I was growing up, and she taught me early on about nutritional fortification and avoiding the toxicities and nitrates and all these things, and I definitely bring that perspective and an appreciation for integrated medicine into any kind of healthcare debate. And broadly speaking, relative to healthcare, you know, from your questions I gathered you're very interested in affordability and access, which I agree are two very important things, but I'd like to suggest a third broad point, which is patients' rights and patients' control over their own healthcare decisions. The thing that, even more than the mandate, that concerns me about the Affordable Care Act is how much power do doctors and individuals have over medical decisions, and how much power is going to insurance companies and pharmaceutical companies. Can they really be trusted to represent the best interest? I want people to go to the doctor they want to have the treatment they want to, not to be led around by the nose. And when it comes to healthcare, this concerns me the most, that people are losing control over their healthcare.
Excuse me. My name is Chuck Erickson. I'm running for House District 91. It's been a long day. One of my House District 91 is East Missoula, Bonner, Milltown, Clinton, and on out that way, and then up to Blackfoot on the right-hand side of the road, but not the left-hand side. One of my interests, being active in the community council in the Bonner, Milltown area, is to get more access to health care for rural areas. One thing we were pushing hard for out there was like a now care clinic at the old Bonner Mill site, which is kind of on hold right now, but we're still pushing for it. My experience in hospitals and medical stuff is basically as a workman's comp receiver. After 40 years in the pipe trades, working construction jobs, I got intimate with that part of it. But as far as the administration part and what our options are, once we reach Helena, I'm kind of in the dark on that still because I'm new too. Thank you.
My name is Sue Malik, and I currently represent House District 98, and I'm running to represent as a senator, Senate District 46. I, like Carolyn, am a strong supporter of the American Care Act. Obama does care. And since last fall, we've seen big improvements in health care. Children have been able to keep health insurance although they had pre-existing conditions. Kids are covered up to age 26 on their parents' policies. We started to close the Medicare donut hole, and more seniors got help with their prescription drugs. And I think all of us probably experienced preventive care being free this year. It made a big difference in my husband's and my life, and I'm sure it did yours as well. I heard on the doors in 2008, the first time I ran, a lot of sad stories about health care and people losing their homes and after having worked 30-some years and having health insurance the whole time, but then experiencing a catastrophic situation. This year, I heard people who benefited from the American Care Act. A woman whose husband is a small business owner. She's a clerical person. Her son, 8-year-old son, got a tumor in his ear, and the insurance company wouldn't cover. And so she contacted John Tester, and the condition was covered. It saved her $40,000. And another friend of mine who has chronic conditions who was able to get treatment after being without insurance for almost 15 years. So, that's me.
Great, thank you all for those nice introductions and what interests you most about healthcare. And I appreciate some of the comments about not quite knowing how to answer, how to work with the incoming administration. I just, as someone who works with the chronically ill cancer patients, they really don't care about the partisanship, and they would like to see you guys all work together. So that's one reason why we asked that question. Let's see, we're gonna go into the access to care, and for the audience, we do have the question that we're asking the candidates, taken from the determined questions. And as many of you touched, We have quite a few Montanans that are not insured right now, approximately 195,000. And as many of you mentioned, the Affordable Care Act does provide some interesting tools. But quite honestly, those tools are available if the state government participates in them. And so, good question about why Affordable Care Act was not a part of specific details in a question. They're embedded all through it for the Affordable Care Act. It is definitely a vehicle that our organizations see as beneficial. There's many things in the Affordable Care Act that also we would like to see improved. But really, it's about how those of you who will be elected will use those resources and tools available to help make sure Montanans are insured. So our question to you is, what are your plans to make health insurance more affordable for people with a chronic condition? And then to add to that, how do we improve access to care for those people in our rural areas? In Montana, you might say frontier areas. Let's see, we started with Senate District 50, so let's move down to Carolyn. We're going to have you start this question and move to the left, and then once Sue, you're done, we'll go back to Cliff.
I'm really anxious for this session in many ways to start, because I am looking forward to maintaining the American Care Act. And with that, we talked about accessibility. And that's always been a concern of mine, because rural Montana does not receive the benefits that we are fortunate enough to receive here. I want to see the nurse practitioner take a new leading role out within the community, because she can work under the supervision of a physician who does not have to be on locale, but he must survey her work and make sure that she's doing the appropriate thing. The same thing for the physician's assistant, who can also work in a community or in two or three communities, but still be under the direction of a physician. You'll find those folks will be more likely to stay in their areas rather than a physician, because a physician is usually penned into 24 hours, 7 days a week. Whereas these people that I'm referring to, the PA and the physician's assistant, are usually normal people, or people, excuse me, they're all normal people that are in the community that are willing to be there and to be of service. So you're not asking them to come in to make a big sacrifice. Ask the wife who would like to go shopping at Macy's to go shopping at, say, the Stevensville Mercantile. So I think it will, if we use the second providers, will do a great bit to promote the accessibility for healthcare.
Got it?
Yeah, I got it. Thank you. Thank you. We have a problem in Montana and in the whole country. We have people that need care in all kinds of things. I am very concerned about cancer. As I mentioned earlier, my father had it. My mother remarried to a physician. I hitchhiked to meet him, hitchhiked from Buffalo to Los Angeles when I graduated from high school, and that was 1949, and at that time he told me that smoking was a cause of cancer. I told people that, they didn't believe me. But it's true. He died of cancer. He didn't smoke. So I'm very concerned about what we can do. We have a big problem, however. How do we finance the things that we want to do for people? The federal government gives all the states money. Montana gets 43% of its income from the federal government. And when you take education, social services, and the prisons, those three take 91% of the total budget. Where are we going to get the money? My forte is that I have been able to look at many things, I have done many things, and I will look at everything, listen, and we'll try to come up with the best solution that we can for the people to do the best job that we can. Thank you.
I think the single most important thing we can do to improve access or to guarantee access to health care is to extend Medicaid. We have the opportunity in the state to extend Medicaid coverage to people at up to 130% of the poverty level, 133%. That's going to mean extending Medicaid coverage to roughly 60,000 people in Montana. That will not only help those people, and the evidence that we have from Oregon, for example, that has conducted a large experiment in the impact of extending Medicaid coverage, is that that it improves medical outcomes, because those patients now get their care from emergency rooms or public clinics, but they get it on a rather haphazard basis. When they're covered by Medicaid, they'll be getting preventative care, early care, they'll have better outcomes, lower mortality. And not only that, but we will also save money for other insured individuals who will no longer have to cover the care of uninsured individuals through higher hospital and non-insurance premiums. So I think that, and that will be largely paid for by the federal government, and I think that the single most important thing we can do is to accept that federal funding and extend Medicaid coverage.
Okay, when it comes to this question, I want to articulate that I am a pragmatist and that I think that the right and the left and everybody in between has a lot of good ideas, and healthcare is very complicated and it's very messy, and I'm really open to finding just any combination that will work. I definitely think that malpractice reform and in the limited ways that we can, increasing competition are great ways to reduce costs. But I also think that we do need to do more just to raise the floor of the social safety net, including expanding Medicare. Because when it comes to things that are life and death, severe chronic pain, these should be things that people can get access to regardless of their situation. And I'm concerned that, just because somebody has insurance doesn't mean they're going to necessarily have quality care or affordable care. I kind of think that the insurance companies and the pharmaceutical interests are in many ways responsible for the 30% growth in healthcare costs every year, and saying that more insurance is going to be better costs is kind of like hiring the mafia to police the streets. I want to, if anything, clamp down on insurance companies and make sure that they're doing things properly. And prevention also is very important. That's a no-brainer because it helps the entire economy. Obviously, if somebody cannot get cancer, that saves them money and everybody all down the line. And I agree also that we should find any way to maintain preventative care is a good idea.
What they said. We're running out of options here. One of the things that I'm concerned with is having enough medically trained people out there, and I think we really need to look seriously at funding the WAMI program and getting the nurse practitioners out there. I guess that's all I have.
We love the briefness. I also would agree with Dick, and I hope that we can expand Medicaid to cover, and that we get 100% coverage in Montana. It's really scary to think that a group of people who are really low income, extremely low income, will have no assistance buying their insurance, and neither will they qualify for Medicaid if we don't expand Medicaid. And as Dick said, if you compare states who have a broad-based Medicaid program, their health outcomes are much better than states who do not. So people get care. And I have to say, this American Care Act is the most so much misinformation out there about it. It's so sad. Actually, the Congressional Budget Office in fact says that we will save money over time. If the act is rescinded, we will go deeper into debt today than we were before it was passed. So not only are we saving money as a government, as a nation, having healthier people, having businesses, small businesses, large businesses who can access health care and get some assistance with that, providing health insurance for their people. It boggles my mind that people are against it. I appreciated what Kim Gillen said last night. She will go to Congress to improve things that need to be changed in the act and certainly not vote 13 times to rescind it.
Thank you. And just a reminder to the candidates to state your name, because this will be aired over Town Square Media, and they have agreed to run this in its entirety. So please remember to state your name before you answer, so people know who's responding. Okay, many of you have touched on it in previous responses, but we're going to talk a little bit about.
Kristen?
Yes.
They didn't get to answer?
Oh. Would you like to answer? I'm so sorry. I was ready for the next question.
Not necessarily.
Well, we're interested to hear what you all have to say. Cliff.
Thank you very much. This is interesting to me to listen to some of the responses, because I think there's a lot of good ideas here, and if we could kind of capsulize a lot of the things that have been said and make it work with, the partisanship that exists, I think we really make great headway. But I do think that expansion of Medicaid is a critical feature. And I'll tell you why, because if young children have good dental health, good physical health, and good mental health, and good nutrition, they grow up to be healthy, well-nourished adults. And we have a haphazard system now of managing that, even though there are thousands and thousands of young children in our state that are on Medicaid. They can't get dental care because dentists won't treat them because the reimbursements aren't high enough. Well, I don't have the answer to that, but if we don't have healthy teeth and healthy bodies and healthy minds, we're not going to have healthy adults. So prevention is the best money we can spend. And in that vein, I think it's really important to expand Medicaid, and also, I think Carolyn hit on it first, having the second level practitioners in the communities able to stay online over time with people will provide some help for lots of people in rural areas. And I notice we have an AHEC person here. I'm on that board. And I know that the Superior Hospital just got $11 million in grants to study delivery of rural health care in a statewide grant. A former employee of mine is actually directing that, and it's very exciting. So I must stop now.
I'm Dave Andrews. I'm glad we have a consensus here on implementing the Affordable Care Act and expanding Medicaid in the process. I've seen I've been doing a lot of canvassing since March, and I've seen, I think, a change in attitudes towards the Affordable Care Act in those 6 months. Early in the time, this was before the Supreme Court decision, there was a lot of hostility toward it, much less so now. And yesterday's Missoulian had a statistic that was interesting. 61% of Montanans 2 years ago opposed the Affordable Care Act. Only 53% oppose it now. Well, that's not great, but it's an improvement. I agree with the consensus that the plans to make health insurance more affordable for people with chronic conditions is clearly implementation of the Affordable Care Act. Some people have been calling it the American Care Act. It's Affordable Care Act, I believe.
My name is Kimberly Dudick. Again, I'm running for House District 99. And I think the single thing that the Montana legislature can do to promote access to affordable care is to fully implement the Affordable Care Act. It has created substantial funding to improve the training for healthcare professionals. It's given funding for the National Health Service Corps, which will help Montanans in repaying educational loans when they provide healthcare and practice where there are areas where there's health professional shortage. It also provides additional funding for supporting teaching centers and providing residency programs. What these things do is it increases our healthcare workforce. There are more doctors, there are more healthcare practitioners to care for Montanans. That will increase the care that Montanans can receive. Additionally, the Affordable Care Act stops annual limits and lifetime limits on insurance coverage. This helps people with chronic conditions because they no longer have to worry about whether or not they can receive insurance coverage for long-term conditions and chronic conditions that cost a lot of money over the life term of the person. Additionally, expanding Medicaid, as we've all heard, will help cover 17 million Americans, and this will actually, as Ms. Malik pointed out, it will end up saving the state's money because the amount of money we spend now in covering people who are not insured will be offset by the small amount of money we'll have to spend by the states in covering the Medicaid, because the federal government will pay this and it will actually help Montanans in whole. Thank you.
Nancy Wilson, I'm running for House District 97, and I will say that I agree with all that people have said. I think the Affordable Care Act has a long way to go still, but I think it's a great first step, and I think we need to do our best to implement it in the state of Montana as well as we can. The one thing that I wanted to touch on that I didn't hear people touch on is, particularly for rural people, the area of transportation to healthcare is huge. So we need to figure out how to have good public transportation to get people to the doctors, not just getting the doctors and nurses to them. There's a lot of people that want to live on their own, and they're elderly, and they want to stay in their homes, and we need to figure out how to get them to medical care in a reasonable way. So that's the thing I'd add to that, and thank you.
Great, thank you. Did I get everybody this time? Wonderful, I apologize. Okay, we're going to move on to something that many of you have touched on, which is consumer protection when it comes to health care. And as mentioned, the Affordable Care Act does do a great many things for those who have pre-existing conditions like cancer, like heart disease, like diabetes. And the problem in our state is there are many consumer protections that the state doesn't have, that we don't even come up to the floor of what now the Affordable Care Act is. And one of those has to do with premium rate review by our insurance commissioner, our state auditor. So this is our question. Montana is one of 3 states that lack any form of rate review for health insurance premiums. Currently, consumers in Montana have no way of knowing what factors contribute to the rising cost of health insurance premiums. This makes it difficult for consumers to make educated decisions when choosing between competing health plans. How would you make health insurance premium rates more transparent for Montana consumers? Will you support legislation that would give the Montana State Auditor the ability to review health insurance premiums before they take effect? And we are going to start with Mr. Carl.
Thank you. The question is whether we would want the auditor to look at the health plans. I say no. And I say it emphatically. When there are differences in premium, differences in coverage, and there always will be differences, or differences in the way the automobile companies make their cars. We do not need government to tell us and tell industry how it should do things. Now, an individual, if we had better education, individuals can look and see what is covered and what the premiums are. And I think that we as individuals should take responsibility ourselves. And by the way, the health care, I'm going to say a couple things on that. Number one, the premiums on that in 2 years are going up to $247 a month. Next, if you are 76 years old, you do not get any coverage for cancer. under that. Next, the government has control of your bank account when you're on Social Security under that. I have the page numbers, I have the whole thing on it, I did research on it. We have a problem. It should be private enterprise, and that is what made our country great, and that is what we have to continue to have. Thank you.
Thank you. Mr. Barrett?
We don't start this until I get the mic turned on, I hope.
12 seconds, sir.
I'm not the bad guy.
In 2011 House Bill 105 did give the would have given the insurance commissioner the authority to review rate increases, and it also would have provided for minimum loss ratios for private insurance. I did not get a chance to vote for that bill, I thought, because it was killed in committee, but I would have if it had not been killed in committee. I do want to say a little bit about minimum loss ratios, because I think that's an important fact. Like most economists, I have a certain amount of disquiet about them because they fail to provide the kind of incentive you might want to have insurance companies control their outlays for medical costs. Because if they spend an extra money, the way they can get more money for themselves is by spending more money on making higher medical expenditures. You kind of want an incentive structure where they'll make more money for themselves by lowering medical costs. So I think we need to think about how we might restructure that system. But in general, I do favor obviously controlling insurance company costs and reviewing and approving rate increases.
Real quick, I don't want to get too wrapped up in the Affordable Care Act. There are some good things in it, but there's a lot of things that aren't good in it, and I don't know how anybody could say with a straight face that it's anything other than a fiscal disaster. But it is the law of the land, and I do think we should implement it and go with the benefits until, if that changes, then it changes. But until then, you can't, go around whining about a battle that you lost. So this is the lay of the land now, and we got to work within that superstructure. I do support insurance rate review, and even more than that, I'm interested in how insurance companies are allowed to make restrictions on how they decide to delegate treatment. I've heard this many instances, I would assume most people here have, where the insurance company says you have to go to this doctor to get this treatment, not the doctor that you wanted, or that you have to have this treatment but not this one. And their justification is X, Y, Z, and you say, well, hey, I have other research or ideas. I think this is just as valid as an idea. My uncle the other day, he's getting shots in his eye because he's going blind, and it's slowing the process down. They made him go to a different doctor, and the guy messed up and stabbed him in the optic nerve. And there's no reason why these things have to be this way. So I really want to rein in their abuse of the authority. In many ways, the Affordable Care Act is the worst of both worlds, because it's basically a giveaway to unaccountable insurance companies, bureaucrats, and pharmaceutical companies that are kind of in a huge power circle. Thank you.
Chuck Erickson, House District 91. I would vote in favor of that. I don't look at the auditors as controllers. I look at them as referees to put everybody on an equal footing. I would vote for it.
I also would vote for it. And I work at the University of Montana now, and we're self-insured. So we have different providers, and we can choose from different policies. It's really nice to be able to look at the different choices and say, this plan, if I choose this, I'll get my whatever covered, depending on what conditions I have. And another policy maybe is one that I'll just pay $15 every time I go to see the doctor, so it's more of an HMO policy. Some cover out-of-state companies, some don't. I think all of us should have that information about the policies available in Montana, and that's what I would foresee happening if the auditor were able to do some tracking of premiums and healthcare coverage. I would point out that we are trying to control private insurance companies to 15% for administrative costs. Medicare is about 5% administrative costs. So when you start talking about private industry being so efficient and so good at providing the best quality care with no interference from any government oversight, remember that the government is us, and that we want these companies to be responsible. We want people who need health care to get affordable health care, and that's what this is all about.
I'm Senator Cliff Larson. I, in a previous life, admit that I was an insurance executive. I worked closely with the insurance commissioner and the auditor's office. I know how that works. I think the question is slightly misdirected because right now the insurance commissioner does have rate review privileges. They simply can't enforce any rate increases or changes. And there's a big difference. And the result is that every year in January, before the 10th of the month, every insurance company that's licensed in Montana to sell health products has to file a Form 13 and basically, pull back the sheets so the public can see what's going on. It doesn't mean that the insurance commissioner does a very good job of educating the public about what's happening there. It's become pro forma for those documents to be filed, and nobody ever asked for a copy of it to look at it. Well, I helped create Allegiance Life and Health, and we did in great detail go through that. And actually, the executive team there believes that there should be rate review and approval by the insurance commissioner, which happens in many, many states. And they have lower administrative cost growth, creep they call it, in those other states. We have an average of 12 to 15% premium increases every year for every insurance company here. And that includes administration, and if you really slice and dice, none of them are losing money, they're all in business, and that's part of the problem.
Thank you, Professor Larson. I think that's actually a really good distinction to bring up. We were implying review and approval. So thank you for that clarification. Mr. Andrews, no, we appreciate it.
Dave Andrews again. On the insurance transparency question, I want to say that I like the idea of, if I understand the insurance exchange is correctly, is that there'll be a standard specification which insurance companies will bid on. Mr. Carl was saying he would like everyone to be a little different. I think medical insurance is too complex to allow that. I would prefer to bid against some standardized specifications I would like to buy against standardized specifications that the insurance companies have bid on, rather than have the ability for them to put in something on the 12th page that changed my coverage. Let me turn to another question which has been brought up in these responses, and that's the overall cost of the Affordable Care Act. There's a great myth out there, you read it in letters to the editor all the time, about the costs being astronomical. The Affordable Care Act's main thrust is to take the 17% nationally, I guess it's 19 or 20% in Montana, uninsured, and shrink that towards zero. You might think that would cost an additional 17% on total health care spending. It does not. The best estimate of the cost of taking those 17% and making it zero is about 3%. And the reason is, of course, we're already paying a good bit of the 17% cost in their emergency room care and so forth by charity care.
Kimberly Dudick again for House District 99, and I would support having the Montana State Auditor to have this authority. As Representative Barrett pointed out, there was a bill in the 2011 legislature that would have given her that authority, but the Republican Party and the representatives from the Republican Party chose to strike that bill because they didn't want to implement what they called Obamacare. because they didn't think that it would become effective or that the Supreme Court would overturn it. But now it is the law of the land, and the Montana Constitution, Section 3, or Article 2, Section 3 provides that Montanans have the right to seek their safety, health, and happiness in all lawful ways. It is lawful that the Affordable Care Act should be implemented and that our state auditors should be given this authority. By not implementing it, the legislature has harmed Montana citizens. For example, there is an insurance company that wanted to have an 18% rate increase, and the state auditor knew of this increase but was powerless to do anything about it. That same company in South Dakota tried to have the same 18% health insurance increase, but because that state had implemented the Affordable Care Act and given their state auditor that authority, that insurance rate increase was
Brian, would you please come to West Valley? Brian to West Valley.
Was not permitted, and that rate was only then changed to 8%. That's a difference of 10%, and that comes out of the pockets of Montana citizens. We're talking about free enterprise and how private enterprise should be able to kind of duke this out and see who comes out in the end the best. Well, if that is allowed, it'll be the insurance companies at the expense of Montana citizens. Thank you.
Nancy Wilson, running for House District 97. I'm going to switch. I'm going to sit next to Kim Dugan in the House, and I'm going to lean on her for that. I tell you, when I pick up an insurance piece, I don't know about the rest of you, but I quake. I'm like, I don't want to read this. This is just, it just boggles my mind. So I used to pick the one with the, that gave you the best coverage. I was like, okay, I just want the best coverage. I don't want to look at it any more than that. And then I got cancer. And I thought, well, I know that I'm only going to have to pay $3,000. That's what my insurance plan said. That's the most I'd ever have to pay. Well, let me tell you, a single mom with 2 children, I ended up paying over $8,000 out of pocket because the insurance company had all sorts of things that they couldn't pay. So the line that said you will never have to pay over $3,000 was a lie. I want somebody that has authority to say, when it says $3,000 is what I have to pay, that's what I have to pay. So I would definitely support this. Thank you.
Excuse me. Carol Squires, House District 96. Well, I'm one of the fortunate ones here, probably the only one that had the golden opportunity to sit and watch the Republicans emasculate the American Affordable Care Act in my Business and Labor Committee. This bill was brought before the committee, and of course on a party line vote, it went down. And they only tried it about, I don't know how many times on the floor to make sure that the auditor did not get any authority at all to do anything in regards to ACA. But anyhow, what it is, she's one of 3 auditors in all of the United States that does not have the ability to look at any health care coverage for anybody in the state and make any recommendation or be able to go to an insurance company and take them down. She can look at the rates, she can make comment to them, but there's absolutely no disciplinary action, no nothing that the auditor can do. Many senior citizens, I've been told, and it's been related to me equally as well, have called and wanted to know, what is my benefit? I don't quite understand this, but the auditor's office has a place where seniors can call and find out what their coverage is, the advantage of the Medicare ones, those type of things. I want to tell you that you will have an exchange, and it will be here January 2014, much to the dismay of many Republicans in the legislature. It will be there because it will be made by the federal government. And I'm sorry, I just have to finish this. It will be made by the federal government because it had to have been started in the mid part of June 2012, and we had to be working on it, and we took vote after vote after vote to get her to have the permission to be able to sit and have the discretion to take care of us as Montana citizens in regards to our health care. And I think it's despicable what the quote majority did to us in that adventure. Sorry to be partisan. No, I'm not.
We'll just take the time for your next answer.
I mean, that one,
You all are doing very well about keeping within your
that
time.
one pushes the button, I'm sorry.
I'll yield her my time.
Okay. Well, thank you very much. There are a couple candidates that you'll see have to leave us because they have other obligations, but I do thank you for doing that. And on your way out, Nancy, as the candidates leave, if you could sign the, just leave your signature that you agree to have this filmed with Aaron at the, that'd be great. The mass exodus. Well, thank you. We're going to switch gears. We've talked a lot about access to care and healthcare coverage. Now we're going to talk a little bit more about public health. And many of the organizations that are involved with Health Votes Montana understand the role that tobacco use has in either causing someone to have a chronic illness or, trying to crack here, a chronic illness or making their chronic illness worse. Just to give you an example, 30% of all cancer-related deaths can be attributed to smoking. That's not even spit tobacco. If you add that in, it's even more. And in 1998, the state of Montana filed a lawsuit with several other states called the tobacco, against the major tobacco industry for millions of dollars our state receives because of the expense to the state that tobacco illness, the burden it has on the state and our government coffers. The other important fact that I think is good for all of us to know is that 90% of all long-term tobacco users, cigarette users, started between the age of 12 and 18, excuse me. 50% start between the age of 12 and 15. So we see this as a child onset addiction. So when you look at the policies that our organizations have worked toward, they're evidence-based and are proven effective in reducing youth use and helping those who want to quit. On that measure, with the 1998 settlement, there were no strings attached, and that's one of the reasons we believe the industry settled, because there was no requirement that any of that money be used to prevent further death and disease caused by tobacco use. So many of our groups, along with dozens of others, went and time again requested that the legislature secure some of those funds to do just that, to prevent kids from starting and helping those who want to quit through cessation. We didn't get very far at the legislature, so we ended up going through the Citizens Initiative process. Not once, not twice, but 3 times. Each one of those times, the citizens of Montana voted in support of settlement dollars or tobacco tax money to go into tobacco prevention and also other health care at 60, I think the lowest percentage of Montanans that voted for that was 63%, ranging from 70 to 63%. In our opinion, that's a mandate. Those were, most of those were in the first part of the 2000s, so 2000 to 2004. Recent polling shows that it's actually even stronger today. Last session, there was an attempt to dismantle the 2 major citizens initiative that put money into tobacco prevention and also into several health programs like Medicaid provider rate increases, like the Big Sky RX, which helps seniors have more affordable or premium assistance for their prescription drugs. And at one point, many of those programs were zeroed out, and we had to fight really hard to get some of those back in, and quite honestly, they didn't get fully implemented. I guess our question to you is, will you honor the will of the voters and support the full allocation of the master settlement funded prevention funds as instructed by the voters during the 2013 session? Let's see. We are going to start. Paul.
This is pretty easy. Yes, if people voted for it, then that's what they should get. Is that the entirety of the question? Is it just?
Yeah.
Okay.
It can be a simple yes or no, or if you have anything you want to add to it, you sure are welcome to.
No, it seems pretty cut and dry to me, so I'll go ahead and yield on this one.
Chuck Erickson, House District 91. Yes.
Sue Malik, Senate District 46, and I was also am a supporter and was pleased to see, Kristen, that you talked about prescription drug assistance for seniors and subsidies for health care coverage for small businesses and low-income individuals with significant health problems. So certainly these tobacco settlement funds are doing a lot of good work, and we hope to continue them.
Kimberly Dudick for House District 99, and I also will support the will of the people in this issue. I believe the legislature exceeds its authority when it overturns the will of the people, as long as that will is in accordance with the law and it's a lawful will of the people. The legislature is supposed to represent the will of the people, and it needs to do that, not second guess what the people think. Thank you. Thanks.
Excuse me. Carolyn Squires, House District 96. I kind of chuckled because Kristen and I went through these 3 different times. 3 different flavors of debate came out amongst the group. And actually the individuals, the citizens themselves, had different opinions through the whole process. So some of the anxiety and so on and so forth that goes along with this particular initiative has some good history, and when you've got some time and need a good political story, you need to go talk to Kristen about this. But the person we really need to give the credit to in all of his efforts and so on and so forth was former Senator Joe Mazurek, who put it together basically, and went to the legislature and basically set up that particular fund at the legislature. And being a smoker, and at that time I found it a little difficult, got a little less difficult, a little less. So like I say, you need a good story, you need to talk to Kirsten. I support where the money goes now. Thank you.
I used to smoke. My mother caught me when I was 10 years old, and that was it. I think it's terrible to see these kids on the corners of the high school during their breaks that are smoking. We keep wanting to tax, cigarettes go up. I think it has to do with the education. Most of the students that smoke and start smoking, the same with the tattoos, they lack self-confidence. And consequently, they smoke, and it figures that it raises them in the eyes of their peers. We have to do something in a broad sense. And again, anything that we do in the legislature, as far as the fiscal responsibility, we have to look at very carefully. The income of people, non-farm people, has decreased from 36,000 down to below 15,000 from 2007 to now. We have to do something so that we can have the taxes come in to pay for the teachers, to pay for the firemen, to pay for the police, and so on. It is going to be very difficult. And to just go on and say, well, we'll do this, we'll do that, and so on. The government doesn't have any money. So we're going to have to watch and be careful with what we do and how we spend it. And it's up to all of us to help bring it all together. Thank you.
In April of 2011, Sue Malik, Carolyn Squires, and I were among 32 Democrats who sat on the floor of the House contemplating House Bill 2. And that was House Bill 2, the appropriations bill, was the bill that came to the House floor with no money for tobacco prevention. And we spent the entire day, time after time, trying to amend that bill to put money in for tobacco prevention, for women's health, for all kinds of things. And the response was always that we don't have the money. We don't have the money. We don't have the money. We have to raid the tobacco prevention money in order, apparently, we're told, to pay for healthy kids. Well, where are we now? We have $240 million that we were saying all along was there, and which they were saying is not there. Well, there it is. It's sitting there in the bank, and we're going to spend it, I hope, on, among other things, tobacco prevention.
Great, thank you. Let's see, and just so you all know, after the elections, our groups are joining with a larger group of healthcare organizations on a 13 to 18 city tour to go over our legislative priorities and talking more detail. And at that time, that's a good time for you to ask groups like ours, are we doing a good job with those program funds? And are we being responsible to the will of the voters in those programs? So I look forward to having those discussions with you later down the road. Let's see, it is a little before 7. I think we have time for one more prepared question, and then we'll open it up to the public. And let's move to a workforce issue. Ooh. Maybe. Slideshow. We are. Sorry about that. It went right through.
Did you get it?
Oh, it's because they didn't get added on. Okay, I will read it to the audience. I apologize. Okay, so there's so many folks today, many of the candidates have mentioned that we also have a crisis in those who are available in workforce. So here's a question to you all. In your view, what are the most critical healthcare workforce challenges facing Montana, and what specific policies and appropriation approaches would you advance to address those? Let's see. Kim, we're going to start with you.
Okay. Kimberly Dudick for House District 99. And, oh, never mind, that's not the question. And so the workforce issues, I touched on this earlier, and I believe the Affordable Care Act actually does a lot to address the lack of available healthcare providers and helps to improve our workforce for health professionals here in Montana. It allocates $72,000 to support the National Health Services Corps. This assists Montanans in repaying educational loans, and that is that's a big issue that people have to face if they want to enter the healthcare force, is that it's very expensive to receive the training and the pay isn't always that great. So the educational assistance loans really could help more people viably enter that area of work and also have assistance repaying their loans. It also provides $5.4 million for health professionals workforce demonstration projects. And what this does is it helps low-income individuals receive training and enter the healthcare professions that face shortages. We constantly hear about healthcare professional shortages, and this part of the Affordable Care Act will seek to remedy that. Additionally, there is $150,000 to support teaching health centers. This creates new residency slots in community health centers, which will help to increase the health care available to Montanans. Additionally, we've talked about the lack of affordable care and available care in rural healthcare in Montana. Currently, there is 83 community health centers in Montana, and through the Affordable Care Act, they received $36.5 million to improve the health care of Montana citizens, to treat more patients, to improve the care that's given, expand services, and create new sites in medically underserved areas. And those are the policies I'll support.
Carolyn Squires, House District 96. I really like to follow Kim. Anyhow, no, she's very, very well prepared, and I really appreciate it. And very, very knowledgeable for a newbie, and I'm just really proud to have her on the team, as well as the rest of them. So anyhow, what I want to talk primarily about is our funding for the residency program. Billings has one currently now, and I think there's approximately 20 doctors that are over there. And Missoula is planning on doing very much the same thing. And so what that will mean, well, there'll be 20 new resident type doctors who can provide health care to individuals within our city and within our region. And normally what happens when those individuals complete their residency and so on and so forth, they because that's a long period of time, they get to like the area. And guess what? They get to like the people. And then when you like the people, then you know, you like to hunt, then you like to fish, then you so on and so forth. So hopefully through this residency program we're going to be able to draw some new individuals into our area. Also, we need to put more money into the WWAMI program and get more slots at the University of Washington, which will then again provide us some more people with which to come. I think we only have 10 slots there. Hopefully we can provide more money so that we can get those individuals, but it's a retention issue. People do not want to be on 24/7. That's why you get your secondary level, tier level people into the process, and there's relief for them. Thank you.
That's a short cord.
Well, for some reason it got awful short.
Thank you. We have many problems. We all want to help. And to the best of our ability, we want to help. My personal experiences, my wife had Alzheimer's for 9 years before she died. The month after she died, notice my daughter's memory going. We took her to a Dr. Paul Bach, psychiatrist here in town, and that said she was faking. She's now in a rest home, nursing home up here, doesn't know anything, and 2 years to live, and it drained me completely financially. I had done very well, and I am expecting things from government, although I am on Social Security, and I appreciate that. We have to try and help as many people as we can, but we have to do it in a logical, financial way that is fair for everybody. Some people are going to be hurt. In an article that will probably be in the paper tomorrow or the next day, a guest column, I say it's better to cut the arm off today than have the patient die tomorrow. We are all compassionate people, or most of us are, but we have to be realistic in our compassion. And it is difficult at times to see some of the things and not want to do something. We all want to do something, but we have to be realistic. Thank you.
Kimberly and I guess Carolyn as well mentioned a number of things that can be done to encourage people to enter into healthcare professions and to become healthcare providers. But I think our experience, for example, with school teachers, or with university professors, or with whomever, is that you can't get people to do those things unless you pay them adequately. So the other side of promoting the preparation and education of healthcare providers is that we have to compensate them adequately. And I guess I have to go back again to April on the House floor when we were considering House Bill 2. When Representative Fury got up and tried to get an amendment to increase provider rates for home health care workers. And that failed. We have been remarkably lax in adjusting provider rates, compensating for providers. I think that's an issue that we have to address, as well as all the other questions.
Paul Marcusa. I don't have as much technical knowledge on these issues as some of the people here, but definitely we need to make sure that we are getting the best and the brightest coming into the industry. And I kind of touched on what Dick's saying, that we need people to want to be in these industries because they're desirable. I mean, with education, people are afraid to get into education now because it's become such a difficult industry. So, and I think part of that too, there is only so much money to go around, and we do have to prioritize, and it's tough. I think we've all heard medical stories that are just horrifying in what happens to people. But we need to find ways other than spending to I think deal with some of the systemic problems we have in the waste and the duplication and the bureaucracy. We need to make things maybe a little bit more how they ultimately should be. I mean, once upon a time, every town had a doctor, and you could just go see the doctor, and he collected a small fee for his services, and everything was fine. And all of a sudden, we've got into some maze of bureaucracy and rules, and everybody hates it. And I would love to find ways to try to get back to the root of the issue, get back to patient and doctor and common sense, and get away from all of this noise. And we've got to use money where effective. But I think we also got to look at how things are done and whether these things really are systemically the way that they should be, and not just an overlaying consequence of a lot of bureaucracies that have been created at different times for different reasons and the law of unintended consequences. Thanks.
Chuck Erickson, House District 91. Ready for another long one? One of my pet issues is helping these people with their education. College costs are skyrocketing. And we should find some way, and I don't have the answers because I haven't been there yet. I don't know what the options are. But we need to help these people when they do take the call and go to medical school, or help them with their college costs, and when they get out, be it through a internship or whatever. I think that's one of the key issues. Why we're kind of short on doctors and whatnot right now. By the time you get out of medical school, you have such a horrendous educational bill behind you. It's just causes people not to want to do that. They don't want to deal with that. Thank you.
Sue Malik, Senate District 46. The last two sessions, one of the great honors I've had is to be invited to the Whammy dinner. And there's a new director of that program who is a doctor in Kalispell. He changed the selection criteria for the students, so they're coming out of rural communities in Montana. And I want to tell you, they are some of the most outstanding people. You just kind of sit in awe when you meet them. But they all swear as they get up and talk that they're going to come back to Montana. And he pointed out that unless they do their residencies in Montana, the chances are they're going to go to Denver, Seattle, or wherever and do their residency, and they're going to fall in love, and they're going to have somebody marry someone who doesn't want to come back and live in Chinook. So this growth that Kimberly was talking about, we're not only talking about expanding Whammy, as right now we have the first 2 years in Montana. We're talking about expanding the third year in Montana. And once Spokane gets that, Montana will get it. We're opening up 11 new residencies in Missoula. So this is already happening in our state, and I'm very excited about that. I also want us to think about Medicaid expansion, because when you read the newspapers in Georgia and Florida and other parts of the country, they talk about the job opportunities that will arise when we expand Medicaid. And certainly there will be more opportunities for people graduating to find jobs in the medical field.
Everybody had a chance to answer, get a little gun shy. Get that crackling and stop. Guess if I just don't move. So thank you all for responding to the predetermined questions, and I appreciate the thoughtfulness that you all put into your responses, and I can tell that that those of us that are listening have a really good feel for your values and your priorities as it relates to healthcare. We really appreciate that. At this time, we're going to open up for questions from the audience, if there are any. Are there any questions at this time? Okay. Oh, sure. Yeah, let's see.
Matt Gunther with the Center for Rural Affairs. Part of the Affordable Care Act, of course, is setting up these exchanges, and I realize that the deadline for setting up a state-based exchange is going to pass before the session begins in January. I'm curious as to what your guys' preferences would be between letting the Fed set up the state exchange or setting it up ourselves.
Good question.
I couldn't hear the question.
Okay, the question was, with the Affordable Care Act, the states have the choice of setting up their own exchange, a state-based exchange, or a federal-based exchange. And because we're a biennial legislature, we meet every other year, we've missed the deadline. We will have missed the deadline for setting up a state exchange. There is, though, down the line, options for continuing with the federally run or created exchange, or transitioning to a state-run exchange. And he would like to know if which you prefer, staying with the federal once it's implemented, or transitioning to a state.
Can I just ask you a question?
Sure.
I think that the issue is, unless I'm mistaken, it's not a question of whether the exchange will be state-based or not. It's going to be a state-based exchange. It's a question of whether the state government sets it up or the federal government sets it up.
Right. So would you like to start then, Mr. Barrett?
Well, I would have preferred that the state set up the exchange. As Carolyn Squires said earlier, there were bills in the 2011 session that would have given the Insurance Commission the authority to set up a process for developing legislation that would have come to the current session, the upcoming session, to establish state-based exchanges, or to create a state-based exchange. My personal opinion is that the reason that the legislature rejected that was that they were just digging in their heels because they opposed the Affordable Care Act. As far as I'm concerned, it was biting off your nose to spite your face.
Paul Barcuza, yeah, I'd rather we set it up than the feds. In any instance except for military or currency, local is always better. So, yeah.
Chuck Erickson, House District 91. I'd prefer the state set it up myself.
It really was a disservice to our states. The states that have set up exchanges are already witnessing a decrease in healthcare costs, so it was a disservice in that way. It was also a disservice and that we could have taken federal money and put Montanans to work on developing this, and instead it's going to be people in Washington, D.C. doing it for us.
I agree that it should have been state-based, and I think that the Montana legislature really missed out on a unique opportunity to set up something that was state-run, because we know what's best for Montana citizens. We're from Montana, we know what our needs are, we know what works best here, and unfortunately, because the parties chose not to agree in the last legislative session, we have, as Dick said, bitten up your nose to spite your face, and we've worked towards the detriment of Montana. It's already going to be a state-based system, but the federal government is going to set it up, and we just have to work with it from there. Hopefully, the state can eventually take it over and run it in a way that we think is best suited for Montana citizens.
Thank you. If you're asking whether we want to have the state control something or the federal government control something, we certainly are better off having the state control where we can go and talk to the people. I mean, we all know the efficiency of our government, whether it's a post office or whatever it is. They fail in everything. We can do a good job here in Montana, be it create jobs, be it with medical assistance. We just have to have the right tools to do it with, and the right kind of people to discuss the things with. Discussing things back and forth. I happen to have been in the Senate years ago. I was the youngest guy there at the time. I accomplished quite a few things, and I'm very proud of what I did, and I was asked to run again by many, many people. Quite frankly, I'm doing it because of our children. The mess, hopefully we can do something for the young people. And the way I listen and the way I look at things, I was on the Legislative Council, and believe it or not, it was the Democrats that told me to run for it and to be on the council. So I've had a lot of experience. I do listen. I will look at all aspects of every bill, and we have to really be careful. This is going to be one heck of a session. We are going to have a lot of discord. Hopefully we can keep it civil and get the things done that have to be done for Montana and Montanans. Thank you.
Thank you. I am going to use that microphone. Let's see if it corrects me. That's the moment I'm touching right. So, are there any other questions from the audience? Okay. Well, on behalf of Health Votes Montana, I really appreciate each and every one of you taking the time to be here tonight, and thank you for participating in the democratic process. Thank you for taking the time away from your families and in the evenings to campaign and to share with us your perspective on healthcare issues. And we look forward to visiting with each and every one of you in the future. Thank you.